Nurse Kim, what are the common emergencies that you encounter working at Wellington Regional Medical
The
Center?
most common that we get are abdominal pains. That's probably one of the number one reasons somebody signs in is abdominal pain. We get a lot of chest pains. We get a lot of stroke alerts because we're a comprehensive stroke center. And as far as with the chest pains, we also do cardiac cath, things like that, that some other hospitals won't do. The only thing we don't do is open heart, but we can do everything just shy of that.
Nurse Kim, you are a triage nurse,
Correct.
and this is one of the only hospitals in the region that I've seen with a triage center. So, how do you think the triage process helps the health process?
Well, every hospital will have a triage area. It's just usually hidden. We have a room next door that was our original triage office, but over time we found out through people, I guess complaints or suggestions that when they come in the door, they want to see a healthcare professional. They don't want to see security. They don't want to see, a volunteer. They want somebody that knows what they're doing and makes them feel more safe. So they enjoy that part of it.
Okay. What are the resources and strengths that you've seen in this Wellington community?
As far as the community as a whole, the hospital does a lot of things with the community. There's different walks that we do. There's American Heart Walk. There's March of Dimes. They do a lot of different things to raise money for different charities. The cohesiveness of EMS and PBSO are really really well put together. Anytime we need either one of them, if there's a patient and not acting right, let's say somebody comes in on Flocka, I'm sure maybe you've heard a lot about it, they're out of control. So we just get on the phone with PBSO and they come right here within minutes, to help us to restrain the person and get them back to where they need to be. But and then if we need an ambulance to take somebody for a trauma, let's say there's a trauma, an intracranial bleed, so bleeding on the brain, we can't really provide those services here because we don't have a neurosurgeon that works in-house. We send to Del Rey. So usually we'll call AMR, but if AMR cannot get here within 10 minutes, then we call fire rescue. And they usually get right here, take the patient, and bring them right over to the appropriate facility.
Last question.
Sure.
What are the weaknesses that you've seen for health?
The weaknesses I've seen are transportation home is a big thing, and people living on their own who probably shouldn't be. You'll get an 86-year-old lady who comes in with a fall, lives at home. She really shouldn't be living at home, especially since she has some form of dementia. And, we try a lot to get people home health care, and we go through whatever means it takes. We have a social worker actually in the ER now who's trying to help us out. So there's that aspect, getting people home. Sometimes the private ambulances will take them home, but they have to have oxygen. They have to meet certain criteria or their insurance won't pay. When you're looking at a couple $100 bill for an ambulance. We have a wheelchair service. I think that's about $75 plus mileage. Still not very cheap, but it tends to be a big problem in getting people back to where they need to go. Sometimes they'll just sleep in the ER most of the night. And we do cab vouchers, and we did them a lot, and I think that started to cost the facility a lot of money. So we started to go with bus passes. But you do have the people who know your typical system, so they'll come in for one thing. Oh, I need a bus pass because I have to go to my doctor's appointment, or they want to go across town. But I would say that just transportation alone is probably the biggest weakness.
Thank you.
Alrighty.